Welcome to the deep dive. Today, we're cutting through the noise to unravel a really critical and often misunderstood area of nursing, forensic nursing.
That's right. Our deep dive today is into a comprehensive chapter from Varkarolis's Foundations of Psychiatric Mental Health Nursing, 8th edition. That's by Margaret Jordan Halter.
Right.
And our mission really is to distill the core concepts of psychiatric nursing, but specifically within the legal system, making it, truly accessible for anyone interested, especially future nursing professionals listening in.
We'll explore everything from mental health assessment and therapeutic communication to major psychiatric disorders and evidence-based interventions, all through this unique lens of forensic practice.
Exactly.
You'll get step-by-step insight into clinical decision-making, see real-world examples, and understand how these concepts connect directly to, well, your NCLEX priorities and your daily nursing responsibilities. So let's dive in.
Let's do it.
Okay, so let's unpack this term, forensic nursing. It's like a blend of different worlds. What exactly is it?
Well, at its core, forensic nursing applies nursing science to public or legal proceedings. Think of it as combining your biopsychosocial nursing education with scientific investigation and treatment,
Okay.
specifically treatment of trauma and death, particularly for victims and perpetrators of things like abuse, violence, criminal activity, or, traumatic accidents. It truly bridges that gap between healthcare and the legal system.
Oh.
It's a field that really gained traction back in the early 1990s. That's when organizations like the International Association of Forensic Nurses, or IAFN, they were formed to kind of formalize this vital specialty.
So it's not just about treating the physical injuries then, but also really understanding the context of the incident and how that interacts with the law.
Precisely.
What's the biggest impact forensic nurses have on, say, public health?
Well, beyond the direct care, forensic nurses provide consultation, they offer expert court testimony.
Right.
They can even contribute to policy changes within forensic settings. It's a recognition that violence and injury are major public health issues.
Right.
I mean, think about national objectives, like those in Healthy People 2020. They specifically aim to reduce homicides, assaults, child maltreatment. These are all areas where forensic nurses are really on the front lines. They're collecting crucial data and intervening not just to treat, but also, hopefully, to prevent.
That's a really broad scope.
Yeah.
What kind of education does a nurse need to get into this specialized field?
Yeah, the path varies a bit depending on the depth of practice you're aiming for. So a forensic nurse generalist is a registered nurse, could be prepared at the baccalaureate, associate degree, or even the diploma level.
Okay.
They gain that extra expertise through things like certificate programs, continuing education, maybe some legal electives. Their role focuses on assessment and treatment again, victims and perpetrators of violence. Crucial evidence collection and preservation is a big piece, absolutely vital for legal proceedings, and then proper documentation, and having a solid understanding of the legal system, and importantly, the standards of care. You might find them in EDs, trauma teams, or maybe corrections.
And for those who want to go deeper into this specialty.
That's where advanced practice forensic nursing comes in. This is typically at the master's level. Often they'll get an advanced forensic nursing certification, the AFNBC, through the ANCC.
ANCC, right.
These nurses have a much more comprehensive focus. They're integrating nursing, medical, and legal content with a real emphasis on interdisciplinary collaboration.
So teamwork is key.
Absolutely. They've got advanced training in areas like psychiatric assessment, death investigation, forensic wound identification, complex evidence collection, even introductory law. And they pursue DNP or PhD degrees to really push the evidence-based practice and research forward. They're literally shaping the future of forensic nursing science.
It sounds like a forensic nurse can wear many hats then. Can you tell us about some of the more specialized roles within forensic nursing?
Oh, absolutely. Yeah, lots of different hats. One of the earliest and actually largest subspecialties is the sexual assault nurse examiner, or SANE. You've probably heard of it.
Yes, Anis.
SANEs are forensic nurse generalists, but they have specific intensive training in caring for both adult and pediatric victims of sexual assault. This usually involves like a 40-hour course, then a preceptorship, and then national certification. Yeah. It's a critical role. It focuses on compassionate, patient-centered care, right alongside meticulous evidence collection and preservation, which, is vital for justice. Their work is often that first step, not just towards maybe a conviction, but really towards the survivor's journey of healing.
That's incredibly demanding, but so vital. And what about the nurse coroner death investigator role? How does a nurse's perspective contribute there? That seems like a shift.
It is a shift, yeah.
Yeah.
This role emerged around the mid-1990s. It involves nurses determining how and why people die. Traditionally, the coroner was a public official, right? But nurses bring a unique skill set.
How?
Well, they apply their extensive medical knowledge, anatomy, physiology, pathophysiology, pharmacology, even understanding grief processes to make expert judgments. They base these on observations, history, autopsy results, toxicology, other evidence. Their reasoning isn't just about finding the cause. It's about following this rigorous process of deduction and bringing a truly holistic nursing perspective. It can really improve services for families and communities.
Okay, so if a nurse combines that forensic science piece with psychiatric mental health nursing, that becomes forensic psychiatric nursing.
Exactly. You got it. These nurses, whether they're generalists or advanced practice, they merge medical and psychiatric nursing skills with a deep understanding of the criminal justice system.
And evidence is still key.
Oh, absolutely. A key aspect is evidence collection, for example, carefully evaluating a perpetrator's intent or determining if they had what's called diminished capacity, meaning impaired mental functioning at the time of the crime. This kind of in-depth assessment can significantly influence legal outcomes, maybe the degree of the crime charged.
This sounds like it requires immense skill in communication.
Yeah.
I mean, you're dealing with incredibly sensitive situations, often very vulnerable people. How do they navigate that?
It absolutely does. You really hit the nail on the head there. A forensic psychiatric nurse must be exceptionally skilled in interpersonal communication. They need to be able to listen, truly listen, and accept others' values and motivations in a non-judgmental way.
Even when it's difficult.
Especially when it's difficult. You're dealing with complex, often disturbing, highly charged situations involving victims or perpetrators. It's a role that tends to appeal to nurses who thrive in intellectually stimulating environments, who enjoy applying their clinical skills to these complex legal and ethical problems.
Let's delve into the specific applications then. What are some of the key functions that forensic psychiatric nurses actually perform in these unique settings?
Okay, yeah, they have a wide range of functions. An advanced practice psych mental health nurse, an APRN PMH, they might function as a psychotherapist, doing individual, family, or group therapy. They might even have prescriptive privileges for psychopharmacology treatment, although honestly that's often limited in correctional settings, usually due to procedural or maybe economic restrictions.
Right. What about their role in the courtroom?
That leads us to the forensic psychiatric nurse examiner. These nurses conduct court-ordered evaluations. They're often addressing specific questions like legal sanity or competency to proceed.
Okay.
They respond to specific medico-legal questions that the court asks for, and then they render an expert opinion either in a written report or sometimes during courtroom testimony.
Can you clarify those terms? What exactly does legal sanity mean, and how is it different from competency to proceed?
Good question. They often get confused. Legal sanity refers to whether at the time of the act, the individual really understood the nature of their actions or knew they were wrong.
Okay, back then.
Exactly. It's famously linked to the McNaughton rules from way back in 1843. They essentially ask, did they know what they were doing and did they know it was wrong? Later, the concept of irresistible impulse was added. This recognizes that sometimes, even if someone knows right from wrong, a severe mental illness might override their ability to control their behavior. Now, this is different from guilty but mentally ill, where individuals are sent to the correctional system, but they're supposed to receive treatment there.
So competency to proceed is about their current state of mind right now.
Yes, very different. Competency to proceed is all about the defendant's mental condition at the time of the trial. The key question is, can they assist their attorney and understand the legal proceedings now?
And that has to be checked regularly.
It does. That determination of mental capacity in the present, it has to be made each time a court hearing is held. And the forensic nurse examiners, they have to remain neutral, objective, detached. Their professional opinion has to be based on scientific principles and unbiased standards, not personal feelings or, advocating for the individual over the process.
You mentioned testifying in court. What's the difference between a fact witness and an expert witness? It seems like, say, a sane nurse might sometimes be both.
That's a great observation. Yeah, they absolutely can be. A fact witness testifies only about what they personally saw, heard, performed, or documented about a patient's care. Just firsthand experience.
Like the ER nurse documenting injuries.
Exactly. An ER nurse who documented an abused child's injuries would be a fact witness. An expert witness, on the other hand, is recognized by the court because they have superior knowledge or expertise in a specific area, usually from extensive education or specialized experience.
Okay.
They can summarize and explain complex medical records, jargon, terminology to a jury. So yes, a sane nurse is often both. A fact witness for the specific exam they did, and an expert witness because of their specialized SANE certification.
How do they establish that credibility as an expert?
Oh, it involves robust academic preparation, practical experience, being involved professionally in relevant organizations, maybe published research. It's about demonstrating that deep expertise.
Got it. Beyond direct court involvement, where else might a forensic psychiatric nurse lend their unique expertise? What about a consultant role?
Absolutely. They can act as consultants, maybe to mental health agencies or law enforcement. They advise on the care of individuals who have legal issues, particularly those with mental illness. We see more and more overlap there, partly due to things like deinstitutionalization.
Right?
So in this role, they might educate about mental illness, different treatment options, community resources. They advocate for patients and families, ensuring well-being, even if sometimes that might lead to civil detention for treatment.
It's intriguing to think how these skills translate. One role that often surprises people is hostage negotiator. How does a forensic psychiatric nurse fit into that picture?
It sounds like something from TV, right? But it's a real vital role. Since the late 1970s, the FBI and local police have used consultants, including forensic psychiatric nurses, to assess the mental state of perpetrators during hostage situations.
Seriously, what do they do?
Well, they provide suggestions for negotiation techniques based on their assessment. They can link perpetrators to mental health agencies if needed. They assess released hostages for trauma. They even train law enforcement in communication skills.
Wow.
It demands clear thinking under extreme stress, obviously, the ability to communicate effectively across all socioeconomic classes, and just a deep understanding of human behavior in crisis.
And finally, a criminal profiler. That actually seems like a really natural fit for someone with a nursing background, especially psychiatric nursing.
Indeed, it really does. While historically profilers came from various backgrounds, law enforcement, psychology forensic psychiatric nurses are uniquely well suited. A criminal profiler tries to give law enforcement specific info about the type of individual who might have committed a certain crime.
Especially when mental illness is suspected.
Exactly, especially when psychopathology or maybe serial crime is suspected. Their comfort with the nursing process, assessment, diagnosis, planning, implementation, evaluation, makes them really well equipped to sort of reconstruct a crime and understand the criminal's reasoning.
That's fascinating.
And it's interesting, Anne Burgess, who was one of the founders of the International Association of Forensic Nurses, IAFN, she was actually the first identified nurse criminal profiler with the FBI.
No kidding. Okay, so the discussion often shifts towards correctional nursing.
Right.
Is that considered a type of forensic nursing, or is it its own thing?
That's a common question. It's definitely related, but it's generally considered a distinct field. While correctional nurses obviously care for incarcerated patients, just working in a jail or prison doesn't automatically make you a forensic nurse.
Okay.
The distinction often lies in that advanced education and having a specific clinical practice focus within the legal system. However, correctional nursing itself is a critical area of practice. I mean, prisoners are the only population group in the U.S. with a constitutional right to health care.
Really? I didn't know that.
Yes, which means correctional facilities must provide adequate health services. They have to cover both mental and physical illnesses, mainly because incarcerated individuals can't just go seek care on their own.
What are some of the major health challenges in that population, especially for the nurses trying to provide care in that setting?
Oh, the challenges are significant. Incarcerated individuals have much higher rates of serious chronic physical and mental illnesses compared to the general population. Much higher.
Like what specifically?
Well, for example, maybe about 1 in 3 state prisoners with a mental health problem actually receive treatment. But that means thousands more don't. Things like insomnia, major depression, delusions, hallucinations are alarmingly common. And a critical issue, often really unaddressed, is the high prevalence of trauma and PTSD. The correctional environment itself is often just not conducive to the kind of intensive therapy required for that. Plus, about half of all inmates meet criteria for alcohol or substance use disorder, but very, very few receive comprehensive treatment.
This really brings up that major debate, doesn't it? Incarceration is just punishment versus rehabilitation. It sounds like nurses are absolutely crucial to finding any kind of balance there.
Precisely, they're right in the middle of it. And there's strong evidence that treatment works. Treatment for substance use, for instance, whether it's through drug courts or programs inside the facility, it dramatically decreases recidivism.
Yeah, so it makes communities safer too.
Exactly. Holistic, patient-centered care is crucial, not just for the individual inside, but for public safety when they get released. Maybe a case scenario would help illustrate this.
Yeah, that'd be great.
Okay, let's imagine Susan Barnes. She's 34, recently incarcerated for public intoxication and retail theft. She's got a history of bipolar I disorder, multiple incarcerations, usually linked to stopping her meds and self-medicating with crack cocaine.
Okay, a familiar pattern, unfortunately.
Right. Correctional staff notice she's acting erratically, pacing, not sleeping, getting aggressive. So, a forensic psychiatric nurse practitioner interviews Mrs. Barnes. She's hostile, her speech is pressured, she says she feels great, and insists the cops are just out to get me.
Classic mania signs.
Textbook. She's diagnosed with an acute manic phase, so her care plan focuses intensely on safety first, then stabilization, medication management, patient education, trying to establish some sleep hygiene. She's housed in the infirmary until she stabilizes.
Makes sense.
But the NP knows discharge planning is critical from day one. They're assessing her suitability for something like forensic mental health court. That's a program offering specialized services for offenders with severe mental illness.
How does that work?
Well, it requires participation in treatment and follow-up as part of their release terms. The ultimate goal is to break that cycle, right, to prevent her return to jail. This really highlights that complex interplay of mental illness, substance use, the justice system, and the nurse's role in advocating for appropriate treatment and trying to help with reintegration. It's a direct way nurses address that criminalization of mental illness we hear about.
That tension you mentioned earlier, between custody and caring, it sounds like an immense daily challenge. Beyond that specific case, are there common strategies or principles facilities use to try and bridge that divide?
It is a constant, inherent tension. It's a real tightrope walk. Think about another scenario. Suzanne, she's 45, incarcerated for assault. Diagnoses of major depression and PTSD from childhood abuse. She's getting meds from the facility's Psych NP.
Okay.
One day, she's watching TV and suddenly attacks another inmate, screaming, clawing. Staff can't control her, so they put her in solitary use mechanical restraints.
Well,
The MP realizes Suzanne's likely having a PTSD flashback. And the confinement, the restraints, they're actually making it worse. This is that classic dilemma. Staff focuses on security, protecting the environment, that's custody. The MP focuses on Suzanne's therapeutic needs, her psychological well-being, that's caring.
so how do they resolve that?
A successful correctional treatment team has to balance both sides. They need to try and create an environment where rehabilitation is actually possible without compromising the facility's, punitive function and safety requirements. Strategies involve things like constant communication between custody and clinical staff, de-escalation training for everyone, and establishing really clear protocols that prioritize therapeutic intervention whenever possible while always maintaining safety.
And that brings up the really complex topic of seclusion. I remember reading about how difficult a choice that is for nurses.
It is. It's one of the most difficult interventions. There was a qualitative study looking at the lived experience of seclusion in psychiatric forensic settings. It offered some really crucial insights into this ethical dilemma.
What did they find?
Well, patients described their experience, their reactions, the profound impact it had on their mental state, even how they assessed the quality of care they got while secluded. Nurses, on the other hand, they discussed why they used it almost always as a last resort.
Right.
They talked about how they observed and assessed patients during seclusion and the impact it had, not just on the patient, but on their own therapeutic relationship with that patient. Both groups, patients and nurses, emphasized wanting to maintain that therapeutic relationship during seclusion somehow.
That sounds incredibly hard.
Very. Both found seclusion difficult. Both preferred it only as a last resort, but they also acknowledged its necessity sometimes for safety. Patients specifically asked for more information after things stabilized about why it happened, and they recommended post-seclusion debriefing for everyone involved, patients and staff.
That makes sense.
It really highlights that seclusion isn't just, locking a door. It's a deliberate clinical choice, and nurses have this significant obligation to understand its profound impact on the patient, on the quality of care, and on that vital therapeutic relationship.
Considering all of this complex information, what are the broader implications for you, our listener, whether you're a nursing student or just someone really curious about this intersection of healthcare and justice?
Well, it means that forensic nursing, and particularly forensic psychiatric nursing and correctional nursing, it's an emerging and truly vital specialty. It's combining elements of traditional nursing with forensic science and the criminal justice system, all to serve victims and perpetrators of violence.
Yeah.
And this field, it demands not only exceptional clinical expertise, but also that deep understanding of legal concepts like legal sanity, competency, complex ethical considerations, and definitely cultural competence, especially given the diverse populations they encounter.
It really emphasizes the importance of holistic, patient-centered care, doesn't it? Even in what seem like the most challenging, high-stakes environments imaginable, these nurses are truly on the front lines navigating these complex medical, psychiatric, and legal issues. It requires incredible critical thinking and, well, compassion.
Indeed. Understanding these roles is just crucial for anyone entering nursing today, especially as mental health issues increasingly and visibly intertwine with the legal system. It's about providing the best possible care, collecting vital evidence properly, advocating for often very vulnerable populations, and ultimately contributing to both justice and rehabilitation within our communities.
Absolutely. And from the entire team behind the deep dive, and a special thank you from the Last Minute Lecture team, we want to remind you that by delving into these complex areas, you're not just building knowledge, you're actively cultivating the empathy and the critical thinking skills that are so essential for future mental health professionals. Keep asking those big questions.
And we'll keep digging deep.